Hi, my name is Alex G, and I'm a sophomore from Saratoga High School.
My name is Dale Liu, and I'm a freshman from Limburg High School.
We are here today to present our mobile app called Asclepius, which will help patients in rural areas of the world gain access to US and affordable treatment.
So last summer, a girl from my soccer club was diagnosed with leukemia, and she passed away. And during this period of time, I realized how hard it was for her to find proper treatment, and this inspired Alex and I to create this project.
And I heard of a similar story, this time of a 6-month-old infant girl in China who lived in a rural area and therefore could not gain access to affordable and proper treatment. So the father wrote to a US brain cancer expert at Johns Hopkins University, who then flew to China and saved the girl after raising enough funds to do open surgery. And although this is a positive story, it is but a single drop in the ocean of failures, which represents the need for unified cancer support for the millions of other unknown children whose stories are not heard. In the USA, our healthcare system seems to be very advanced, but there are some pretty big problems. What is the challenge here? The challenge is that clinical trials lack data and participants, and patients in lesser developed countries lack access to medicine. This lack of medicine makes it so that even basic treatments can cost well over $100,000, and advanced cutting edge technology is not available to citizens of farther rural off nations. These patients, obviously, being far off, often cannot speak English, and others are stuck in their beds, which makes it hard for them to travel. In the USA, we allocate a fair amount of funding for our pharmaceuticals, about 40%, and all of this goes to trials. Yet, half of the trials cannot take off as they lack participants. Here, we see that 11% out of all the trials cannot even enroll a single person. This is a very big waste of funding. So how will we bridge the gap between no medicine and no participants? We will form a unified platform between patients and doctors to find new drugs and clinical trials for our patients and to find patients and volunteers for our doctors. We will demo this project now for Dale.
So this is a prototype of our app, Asclepius, and this is the landing page for new patients. So basically, they could select their cancer type as well as their cancer stage. And if they don't speak English, they could select another language such as Spanish or Mandarin, like that. So let's just select leukemia as an example and then select the stage and then move on. So this is the main page of our app. The patient can gain access to available treatments, new drugs, the latest research, as well as connect to caregivers. So if they want to find available treatments, just click on this. And then there will be clinical trials, immunotherapy, surgery, as well as alternative therapies available to the patient. So if they want to find clinical trials, click on this, and then there will be a map with all the clinical trials in the United States. And if they live in California, they could click on California and find a clinical trial near them. So let's say they found this clinical trial. So basically, there'll be a rough summary of this trial, also the eligibility of this. So if they're eligible, then they could contact this trial and sign up like that. And back to this page, they could also click on this surgery button. So basically in here, there will be a list of surgeons. And let's say if they want to contact Dr. Lucas, just click on this. And then there'll be a profile overview of this surgeon. And they'll be able to contact them by chat, video, or even book a visit like this. So back to the main page, the patient can also gain access to the latest research. So basically, this is just for the patient to self-educate themselves on their cancer type. And there's a Cancer Today website where they could find patients around the world that have the same cancer disease as them, and also a cancer gene dependency map. So basically, they could find they could use the latest research to help benefit their cancer treatment.
It is important to mention that whatever we have now is merely a prototype. We do not have the support of the doctors because they are very busy and the emails that we sent out have not yet reached their inboxes. And because of this, we still see a need to expand. And although we are currently testing this app in the USA, we will eventually move this out to global and international stages. Thank you for listening.
Thank you.